Wednesday, and that means it's time for us to delve into medical matters. Our resident GP is Dr. Vicky Skitter.
Hi there. So today we're going to talk about skin again. I'm going to talk about vitiligo. Every year on the 25th of June, it's Vitiligo Day to bring awareness to this disease. What is vitiligo? It's an acquired condition where you get depigmented patches of skin when the skin becomes like milky white. We've all seen that. Due to the loss of functional melanocytes. So the melanocytes are those cells in the deep layers of the skin which produces melanin, and that gives you the color of the skin, whether it's light brown or dark brown or, whatever. So this disease can actually cause emotional suffering, I would say, because due to the stigma attached to it, people unfortunately stare and they make rude comments on people with vitiligo. I've seen, which makes my heart sing, actually quite a few beautiful models now recently in magazines and whatever that has vitiligo. And that also brings more awareness to the people. So that's quite cool, I think. Statistically, vitiligo will probably can affect about 2% of the population. So about 100 million people are living with vitiligo globally. It can affect anyone. It can affect males, females, any race. So it doesn't really choose a specific race or anything like that. Then it can affect people anytime from birth to sort of late adulthood. Probably the most common is about year 20, sort of 20 years of age. That's sort of quite common. And 15 to 20% of these patients have some other kind of autoimmune disease as well. So that's quite interesting. It's also very interesting that most people, or a lot of people that develop vitiligo, can often relate the onset of the disease to a specific event or a specific illness, even emotional trauma or severe sunburn, or sometimes even pregnancy. So that's quite interesting. How would we treat it? The treatment, there's no cure really for vitiligo. So it is a lifelong disease, but you can try and improve the appearance. You can try that. So the aim of the treatment would be to firstly stop the deep pigmentation, the lightening of the skin, to try and stop that, and also to repigment it. So where possible, add a bit of pigment if you can. So it's very important for those patients with a milky light skin to be very careful in sun, because the skin's much more sensitive to sunburn and obviously more prone to the development of melanoma. So that's very important to know if you've got that. So be very careful and be diligent with your sun protection. So if you treated, some options, for example, would be high potency cortisone, topical steroids, okay, so that's what we can do. Phototherapy, laser treatment, sometimes surgical treatment that can be used. What's also used is permanent dermal micropigmentation. So that's a therapy that's kind of like a tattoo. So you can tattoo over that milky areas and make it less obvious. So one can do that. And when you've got huge areas where you've got really little pigment left, where most of your skin is actually milky white, you can actually use depigmentation. So you rather get rid of that little bit of pigmented skin than try and figure out what to do with all the milky white areas. And this, you'll use hydroquinone. It bleaches the skin. Interesting, I read an article, and one, you would probably remember the artist Michael Jackson. He suffered from vitiligo. So, during the years, you would see pictures or videos of him, the skin gets lighter and lighter. I assume he used the hydroquinone route, where he would rather get rid of the pigmented areas. So he became very, very pale. But that's someone that we all sort of know about. Lastly, people who has vitiligo please know that there is the Vitiligo Society of South Africa. They've got a website, they've got an Instagram page. You can go onto that. They cover topics on research, clinical trials, what's happening, upcoming events, and a heap of other info. So it's definitely worth going to look at that site, give you some support. And it's important for people to be aware of vitiligo, know that it's basically an autoimmune disease. And, one needs to be sensitive to those people and, be aware that this is quite a common thing. So that's the rundown on vitiligo. I will see you again next week. Bye.